Good evening and welcome to my presentation on the defense for the dissertation by Arsalan Gharavais for partial completion of the requirements to acquire a doctorate in architecture at Texas A&M University. The subject of the dissertation is research to improve hospital emergency department design to enhance teamwork and collaborative communication. The challenge was that in the Houston area, Houston Methodist Hospital serves a growing metro population of over 7 million people. They feature 6 hospitals and ER services, and they've earned the academic distinction of being a leading medical center in Texas. And because of this, they had a sincere interest to make sure that they're keeping up with the times and providing the best quality emergency services possible. The increased demand on emergency services certainly increased the need for efficiency. The research problem that Gharavais took on was a look at how architecture and design could affect the functioning of emergency teams on site. With this, he needed to look at existing facilities for optimal space, measure light and acoustics and floor plans, and also study the human aspect of communication among doctors, nurses, and other medical personnel. He felt that visibility was key, that lines of sight would affect not only the communication and the collaboration, but also provide improved security because there had been complaints of violence towards staff members in the ERs for these hospitals. The methodology chosen by Gharavais was a mixed method using quantitative measures as well as qualitative. He had plenty of things that he could measure for the quantitative, but he also needed the human behavior and perceptions of the people who worked on site. So the mixed methods appeared to be the best solution. His population sample, he looked at 4 hospitals with emergency departments in the Houston metro area. He analyzed the space of the floor plans, reviewed the environment in terms of lighting, acoustics, and lines of sight. And he also surveyed and interviewed doctors and nurses at each one of the sites. Before he began his actual research, he did a pilot study in July of 2016, rather, and the actual research began in September of 2016 and lasted for 2 months. The purpose of the pilot study was to really get a good look at the floor plans, the staffing and staff protocols of those 4 spaces, the patient service caseload, and to determine the appropriate assessment instruments to get some data on perceptions, validated testing on perceptions of communication and teamwork. He conducted interviews. The interview participants, the goals were 2 doctors and 2 nurses from each site, but he actually conducted 17 actual interviews. And the interview contents were perceptions of visibility, teamwork, communication, and their own perceptions of security within their departments. He then conducted field observations. He actually went on site to each of the hospitals and spent 12 hours of observation. He chose the busiest times of the day and observed and noted the location where the staff were. He even timed the communication interactions between the staff. And he also measured the actual distances of lines of sight. The instrumentation he used for his research, well, he used computer analysis. A software called Depth Map was used to measure and analyze the floor plans. And it was a new form of a scanning device to be able to do that. The field observations obviously measured the dynamic visibility that was present. He used validated surveys and also measured the lighting and acoustics and reviewed hospital security reports for detail about security incidents. The data was actually collected in September and October of 2016, and He, again, collected all the data about the visibility, the floor plans, the measurements, his actual observation from recorded notes and audio and visual recordings. Surveys were administered and tabulated, and the interviews were conducted, recorded, and transcribed and checked for accuracy. With the interviews, he was able to put together some themes that could be useful later on. The data analysis, he used the depth map to scan and analyze the floor plans. He looked for comments from the survey and interview participants because they were voluntary to give him some actual lived experience by the people who were there. Data from the surveys were tabulated. The field observation used by staff for communication was averaged. And the security reports were analyzed for locations of incidents and nature of whatever infraction occurred. Assumptions or limitations. One of the things that I found when I looked through the research that was the basis for the writing of the dissertation, the assumption was that communications between the doctors and nurses were the most important. And it left out other people that are part of the team: diagnostic technicians, support staff, EMTs, ambulance drivers, and even the security guards. It was also the assumption that visibility was the main factor affecting collaboration, communication, and teamwork. He proved several hypotheses. He proved that visibility does improve communication among members of emergency services team, or at least the doctors and nurses that were surveyed, and that visibility does improve teamwork among these team members. And it was interesting that a reoccurring theme was that direct eye contact was perceived as one of the most important things for improved teamwork. The hypotheses that were not proved that could require some additional research were that visibility enhances collaboration among team members. Yes, it probably affects it, but there was a need to look at the hierarchy of authority and whether there's a culture that provides for empowerment. Could people make decisions because there's such a need to act quickly in a hospital emergency room? The other thing was visibility. The other hypothesis not proved was that visibility provides protection against violence and results in security issues. Well, there really wasn't enough data. There were not, I'm sure he read through all of the security reports, but there wasn't any lived experience from interviews with security guards. And I think that this would be a good topic for separate study. And these were some additional suggestions that I had based on what I saw in the dissertation. Again, it was important to interview and survey all the emergency services staff because they're all important. Study the management roles and culture that related to the collaboration. And also to create that separate research study on hospital violence. The success of this research effort was that he was able to create a model for the design of hospital emergency departments that would be very useful to designing new hospitals, improving existing facilities, and that better lines of sight improved communication and teamwork. He brought attention to the needed design features in hospital emergency departments and wrote this about a year later in an article that appeared in an international journal article, with some esteemed colleagues assisting, but his research was the basis for this article. It also called attention to the increasing demands of emergency staff and facilities. And one of the things that I thought was most useful was his application of the needs of the people who actually work there with design features from an architectural standpoint. Sometimes I've found that there are times when buildings are designed with not the occupants in mind who work there. The references I used for this particular presentation were, of course, the the dissertation by Arsalan Gervais, and the official title is The Impact of Visibility on Teamwork, Collaborative Communication, and Security in Emergency Departments. I also use the website from Houston Methodist Hospital to get some details about their hospital system, and then for guidance about presenting a dissertation defense from Roberts and Hyatt from their work, The Dissertation Journey, a practical guide and comprehensive guide to planning, writing, and defending your dissertation. I believe that this was a very successful effort, and certainly Arsalan Gervais gained additional funding for his research, and I am certain that he's going further in hospital and healthcare facilities design. I want to thank you for listening to my presentation, and I would enjoy having some questions. Thank you.